Hello, I'm Nancy Bergerson, and I'm here to present Better Nutrition, Healthier Schools. Today I'm here to present to administrators, teachers, and staff from 4 main school districts who have requested policies and practices that support nutritional health choices that can be implemented with limited funding. And I'm presenting as a representative of Maine's Public Health Nutrition Program. The objective of my presentation is to present cost-effective strategies promoting healthy nutrition among school-age children and adolescents in order to combat obesity and damage to long-term health resulting from poor nutrition. This slide shows some statistics on obesity among the school-age children in Maine. And these were collected by the State of Obesity, which is a collaborative project of the Trust for America's Health and is supported by the Robert Wood Johnson Foundation. In their 2017 annual State of Obesity report, they report that in Maine, approximately 28% of 10 to 17-year-olds in 2016 and roughly 13% of high school students in 2015 were classified as either overweight or obese. In 2016, the State of Obesity reported that 1 in 4 children aged 2 to 5 are already either overweight or obese. The prevalence of obesity among 6 to 17-year-olds has doubled in the past 30 years. In addition to putting children at risk for type 2 diabetes, asthma, anxiety and depression, and low self-esteem, childhood obesity also raises the risk of future coronary artery disease. Lack of a healthy diet also affects cognitive development, behavior, and academic performance. Obesity-related costs run approximately $147 billion annually in the U.S. health system. So providing a healthy diet produces a number of positive outcomes: improved overall health and quality of life, prevention of obesity and metabolic syndrome, prevention against inadequate bone health, prevention of undernutrition and iron deficiency, prevention of eating disorders, prevention of dental caries, and prevention of early onset of chronic diseases which can result in premature death. So I'm going to take a look at a couple of proposed programs that I have put together. So there are some strategies to promote better nutrition. First, examine participation in programs such as the school breakfast program, the school lunch program, and the summer food service programs provided by the USDA. And ensure that parents of your students are aware of community-based programs such as SNAP, WIC, and local pantries. Educate your students and families on the importance of proper nutrition that meets the dietary guidelines published by the USDA. And there is additional information available on the Maine Department of Education website, which contains links to handbooks and manuals, menu planning tools, and information on wellness and food safety. And here I've listed the USDA dietary guidelines. They are to eat a variety of foods, balance your food intake with physical activity, choose a diet rich in grains, vegetables, and fruit. Choose a diet low in saturated fat, and cholesterol. Choose a diet moderate in sugars and moderate in salt and sodium. Although children are eating more fruits and vegetables, 60% did not eat enough fruit to meet the daily recommendations in 2007 to 2010, and 93% of children did not eat enough vegetables. Schools have the ability to reach most children and teens, as well as the ability to address peer pressure, which might discourage healthy eating. Education of school personnel and school-based nutrition education can improve the eating behaviors of children and teens. There are some simple ways to instill healthy eating in school. Some examples are to offer a fruit or vegetable option with each meal, eliminate foods containing trans fats, serve whole grains, eliminate sugar-sweetened drinks, and offer water as a beverage. And policies relating to this don't have to be very complex. I took a couple of examples from the T.H. Chan of School of Public Health at Harvard, which show how simple it can be to put together some policies. I recommend that you provide low-fat, low-sodium foods in vending machines if you have those and at school events. Serve healthy, well-balanced menus in the school cafeteria. Organize within your community to conduct a nutrition education campaign. Offer dietary guidance through school nurses or counselors. Ensure that your school staff provides a model of healthy eating. And ensure that policies meet the needs of the geographic, ethnic, socioeconomic, and cultural landscape of your area, and emphasize the importance of reducing the rate of overweight and obesity among children and teens to prevent chronic diseases. The Smarter Lunchrooms movement partners with Let's Go, which is a nationally recognized childhood obesity prevention program of the Barbara Bush Children's Hospital at Maine Medical Center, and provides ongoing support, training, technical assistance through regional work group meetings that identify the challenges and create solutions to providing healthy school meals. And the program also offers research, training, and evaluation tools. The USDA's National School Lunch Program reimburses schools an additional 6 cents per meal to comply with the new nutrition standards. This program will cost 10 to 34 cents per meal to implement. So for an average Maine elementary school, the cost to make the changes is less than $10,000 per year. The second program is Farm to School. This program connects communities with fresh, healthy food and local food producers. Students have access to healthy local foods and learn informed food choices. Local foods are purchased, promoted, and served at the cafeteria. And this program can be partnered with the Maine School Garden Network. With this program, schools have noted improvement in student health and dietary behaviors, and they've noted a 44.2% of students eat more fruits and vegetables and demonstrate willingness to try new foods and healthier options. The Farm to School program can also provide surplus food for students in need to take home for their weekend meals. And information relative to these programs that I presented and others can be accessed on the Maine Department of Education Child Nutrition website. There are some increased costs affiliated with this program. The cost to prepare raw foods and monitor salad bars, training your staff to prepare new dishes, and local organic foods may cost more than their counterparts, and you're also forging new business relationships with local growers, which may have some increased initial cost. Most successful farm-to-school programs have developed or secured active leaders to guide the programs forward through the political and institutional barriers that they may meet to before achieving their goals. And successful programs involve diverse stakeholders that support the program in a variety of ways, both from within and outside of the school district. And leaders and community farm-to-school teams have become adept at skillfully leveraging resources to deal with the hurdles as they arise. I'm going to look at some resources to assist with the costs of the programs. And I'll cover some funding sources of grants. Fresh Fruit and Vegetables Program offers a farm-to-school grants planning award of $20,000 to $50,000, implementing from $50,000 to $100,000, and training from $20,000 to $50,000. Love Your Veggies, which is sponsored by Hidden Valley, gives a $15,000 grant to 51 elementary schools, one in every state, that commit to increasing access and consumption of fresh fruits and vegetables with school meals. Got Breakfast, the Silent Hero program, gives up to $100,000 to schools participating in the National School Breakfast Program. USDA Farm to School program provides grants of $20,000 to $100,000 to help schools create school gardens and other programs bringing local foods to students. And Take Action funding gives between $2,000 and $5,000, and the program is nationally evaluated. And just a couple of other resources. Of course, I've mentioned the Maine State Department of Education website has an abundance of information, and 2 SNAP-Ed programs that materials can be ordered and taught by classroom teachers. These are my resources, and these and other materials presented today can be found on my fact sheet. And thank you, and I will answer any questions.